Hi, my name is Jennifer Marshall, and I'm joining you from the University of South Florida College of Public Health. Our research team has been evaluating systems of care for pregnant women, infants, and families with children, including children with special healthcare needs, for several years, and have focused more specifically on hurricane response this past year. We're interested in how maternal child health and community support systems for vulnerable populations operate during normal conditions and how these systems are tested and adapt during disaster situations, including natural disasters and epidemics. We're currently leading a national work group funded by the National Science Foundation through the Natural Hazards Center in partnership with Old Dominion University colleagues to study hurricane response for vulnerable and medically fragile populations during this compound hurricane COVID-19 pandemic situation. Our research will extend through this year with support from the University of South Florida Rapid Response Funds that again will allow us to dig deeper into the adaptations that need to be made to disaster plans for all segments of our population. Some of the considerations include defining vulnerability and medically fragile, shelter and transportation operations, infectious disease control and continuity of healthcare, public messaging and risk communications, workforce staffing and volunteers, and psychological adjustment for disaster workers and evacuees. We continue to broaden our definitions of vulnerable populations and recognize that any individuals that are exposed to violence or exploitation are particularly at risk for additional challenges during the COVID-19 hurricane season. In fact, from our research this past year, we found that safety was one of the top concerns of families. Safety at home, in shelters, and in relocation or displacement settings during and following a hurricane. We learned that much can be done by community health workers, home visitors, case managers, any trusted messengers that have a relationship with a family to help them come up with a plan and perhaps additional contingency plans that are realistic, attainable, and also safe for them. Because families are complex and many Floridians don't have the economic resources or the social connections to easily prepare for a storm, to evacuate if needed, and to recover, sometimes over months, following the storm, our health and social service agencies and civic groups should really reach out to families now and establish those lines of communication. We can't rely solely on the media or websites to help families assess their personal risks, to answer their questions, or to de-escalate crises. Thankfully for women, children, and families, we have strong and caring public health infrastructure in Florida. We have Healthy Start coalitions, the Department of Children and Families and Early Childhood Courts, the Department of Health, and others. My team will continue to map these relationships and systems to identify gaps and safety nets that are in place and opportunities to strengthen quality and continuity of care. Thanks for listening.